about the medication, the drugs used, like fentanyls and morphine and propofol. What's the difference between like
Very specific
fentanyl?
one. I don't know.
Because
Yeah, should I study
fentanyl and
more?
morphine are both like it's kind of similar drugs.
Yeah, there are kind of
Is
similar
morphine
drugs
is an
out there.
opioid,
Is an
but
opioid. Is out there a product.
fentanyl is
Yeah,
more is chemical opioid.
yeah.
It's
Is
not from natural
yeah. It's
plants,
more.
isn't
It's
it?
like more chemical. Yeah, yeah. It's more. It's more the production. It's more synthetic and they work a little bit in a different way.
When you
Um,
use fentanyl, when you use morphine,
to be fair, we don't use. Depends. So fentanyl we don't use that so much in my unit. We tend to use alfentanil. That, to be fair, I don't remember exactly the difference between alfentanil and fentanyl. They did, I think, the time the body they did not last so long. In example, in neuro, they tend to use the fentanyl. Uh, Morphine. The advantages of fentanyl usually is more for sedation and pain relief. Morphine you use more for pain relief. Pain relief things. So it's never using like in continuous infusion.
okay,
Fentanyl you use them in a you can use them in a
infusion,
continuous infusion. You can use them also in moment like intubation. Morphine is usually predominant as a painkiller. A lot of used still in emergency department.
yeah.
A lot used in still in pro hospital. With its pros and cons, these like influence a lot, the blood pressure. Most of all, if you are a traumatic patient, it's still very discussed the use of morphine on a trauma patient with like blood loss. You don't they just abandon it in the most of the military example. In the past they were living like still like in pen to inject morphine and has been abandoned practically by the most of the army internationally. I mean, I'm not for sure the Americans and even I think the British too.
Can
um,
those drugs here been self-administered, and can a patient become addicted with these drugs?
Addiction it's not so easy to develop as we think. Um, we offshore there is some sort of addiction. You need to get them not use it to the medication for too long. But of course, every time when you stop a medication like that, and they've been for a long time on this kind of medication, can give them a little bit of trouble in getting rid of that. But it's not like an addiction like when you were talking about addiction, like example in America they're talking about a lot of the addiction of painkillers, addiction to this kind of morphine opioids, and that they get used by the doctors that they prescribe them, and that they can keep taking, and then there's the mental addiction because they're taking on themselves. It's not the same thing. But yeah, it can give an addiction, but
Yeah.
it's not so easy in our environment. I think we don't notice this problem. We notice maybe that the patient needs to go, if it's been for a long time, this kind of medication maybe need to continue a little bit, and
Like
then
going
slightly,
progression
yeah,
down a
yeah,
little bit. Yeah.
everything needs to go slowly down, um, because they still need that, or because they are in pain anyway. So I one of the funny thing I noticed is example, I was giving a morphine in any like water when they were like really in pain, and that was not affecting at all their blood pressure,
Yeah.
because they were in a lot of pain, and they were helping a little bit, so they were not suffering. They were suffering less, but they were not having issue like. One of the problem with morphine is and the whole fentanyl and anything like that is your breathing ratio can go down and stop. But when they are on such a
they
much
can.
then the risk is not the same. But you have to be careful and give the small dosage, and see react. I had a bad experience when I gave too much to a patient, and I was elderly, and nearly stopped breathing, and I had to give naloxone and reverse the effect of the morphine that I gave, and it was not a very nice experience. I still remember that. Quite shocking. But yeah, you got naloxone, you can balance. In the case stream, but it's been only one case in all my career.
And then the propofol is also called the milk of amnesia. It's different because
Yeah,
like
propofol give you sedation and can influence blood pressure too, and can give you hallucination on a long time, sort of sleeping but not totally sleeping as a sedation. So a lot of times we think like people they are sleeping but they are not really sleeping. It's like a sedation. It's like they keep them calm, they keep them like their brain activity is still there,
yeah.
and you can see the patient even like when you like keeping doing noise around them, light, even if they are sedated, you can see that difference. Or if they are in pain, you can see the difference in their blood pressure. You can see the difference in their heart rate. So you learn these things with the experience, and they can sleep even when they are sedated. So